Welcome to Frontline Nursing, a NurseMinder production that gives you an insider's look into the daily life of nursing from those who are currently working on the front lines. Whether you're considering nursing as a profession, you're a student already, or perhaps you're a nurse who's looking to transition towards a new career, this show will give you some behind-the-scenes information to help guide you. Today's episode is all about primary care nursing and the role that they play in maintaining the health of members in the community. So get those notes and pens and papers ready, because we're going to get started. Today on Frontline Nursing, we are joined by Ashley White, an LPN who has been working as a primary care nurse for the last 3 years. Welcome to the show, Ashley.
Thank you.
Yeah, it's great to have you here. So let's just get kind of started with, how did you find nursing to be your career?
So I'd worked in the medical field for many years as a medical office assistant, and we had nurses in the office, and I always kind of found myself kind of a little bit jealous of them and that they got to actually have more like patient interaction than I did when I was doing more admin thing. And so kind of stepped back and examined my life and where do I want to go and what do I want out of it, and decided that was kind of the path that I wanted to take. So yeah.
Oh, so you were inspired by coworkers. It's funny, I got my start working as a medical transcriptionist in an office as well.
Yeah.
And I remember one day a doctor coming to me saying, "What are you going to do with your life?" Because I'd always told him this wasn't the end job for me.
Yeah, exactly.
Yeah, and he was like, "You should be a doctor." And I'm like, "No, thanks."
No.
I see your lifestyle. I'll be happy to do something different. So that's awesome. Did you, when you started nursing school, did you think community health would be where you would end up, or did you have another plan when you started?
I think ultimately I didn't think I'd actually be in community health nursing. I kind of pictured myself on a unit somewhere, like I don't know kind of where specifically, but kind of pictured myself in acute care on a unit. But ultimately community health kind of ended up being my niche after all. So.
And was your final preceptor or any of your clinicals in that area?
It was not. No. I done some child psych, and I was on a cardiac unit. And after graduating, had worked on a couple units at the Royal Alex and stuff like that. But ultimately, kind of found my way back to community health nursing. So yeah.
Pretty amazing. Now, I know within community health nursing, there is a lot of different avenues, even within that specialty, that a person can take. Much like in the hospital, you can be GI or GU or thoracics. Talk a little bit about some of the opportunities that exist for someone who's listening right now and thinking, I kind of think this might be an interesting occupation for me.
Definitely there are tons of primary care networks around, and within those primary care networks, within the different medical offices, there's so much scope for nurses. Different things, you can do dermatology, you can do women's health, you can work with more geriatric patient. Like there's so much to do just within like a primary care clinical setting. So definitely just kind of listening to yourself and what you think maybe some of your interests are, talking to people, talking to the different clinics, kind of seeing what's out there.
Yeah. Can you share some of your experiences in the different areas maybe you've been involved with so far, and maybe just how that's really impacted you in staying in this area?
Sure. So mainly I've worked in women's health, but there's tons of just general family patients with that as well. So everywhere from babies to seniors, a lot of complex care plans, a lot of preventative medicine, which I kind of being sort of on that front line, stopping people needing to go to hospital, needing to go to emergency, kind of putting those lifestyle changes in place before things kind of get bad. And just kind of being able to see people make progress and make those changes and be there and kind of see their journey. The women's health is really interesting as well. Contraception, first prenatals, all that kind of stuff. Very interesting as well. You're doing lots of immunizations, stuff like that. So kind of a variety every day, which is nice. It's not the same thing kind of coming in the door every day. So that's really nice.
How much of your job would you say is patient education?
Oh, like all of it. It really is, because if you're giving immunizations, you're having those conversations, you're educating about it. What are your next steps? Why are we doing this? If you're doing a prenatal exam, you're teaching about nutrition and what to watch for, all that sort of thing, contraception, and then just your complete physicals, complex care reviews, all of that is education. So I don't think I leave a room not having given some sort of education to somebody, whether they want it or not.
And do you find that you're learning just as much from the patients? Often in acute care, as I'm assuming it's the same in primary care as well, but because they've lived with these conditions for a while, they know them so much more intimately than whatever we could get from a textbook. So do you find that there's kind of this symbiotic co-transfer of information?
Absolutely. And just even people's take on things and how you need to learn to educate people based on their personalities and how they're taking information, how much they want to take on. Comorbidities, like, how you're educating based on those couple things. But yeah, you're always learning from your patients.
Yeah, that's good. I find that the same in acute care too. So it's nice to know that still exists.
Yeah.
So kind of a typical day, I'm assuming you're working 8-hour days, Monday to Friday, potentially?
Yes. Yeah. That's lovely.
I know. Are there PCN roles where they would be working evenings, weekends, that kind of thing?
Yeah, depending on the clinic. Some clinics are open on weekends, some are open later. No sort of like overnight shifts or anything like that, but definitely every clinic is going to be a variety based on what their doctors are doing at those clinics.
Sure. And I know depending on the patient population, it may also impact then how long you have with each patient and the follow-up process and how often you're going to see them in the community.
Exactly. And even just based on your clinic, like, do your doctors like you to see the patients ahead of time? Do they want you to see them after? Are you specifically just seeing the patient yourself for certain kinds of exams? So yeah, it's all kind of variety based on sort of preferences and sort of the demographic of that clinic as well. So yeah.
Are you able to maybe talk a little bit about some of the independence that you have within the various roles that you've had? Is that okay?
Yeah. The clinics that I've been at, the doctor always lays their eyes on the patient. So I'm not just sort of like independently seeing them and then they're shipped out, but a lot of times I am just going and doing injections or ear flushes or going and doing teaching for contraception or like IUD consultations that I've done. I'm going in and doing the whole consult. The doctor comes in and does the inserts, but sort of all the education and stuff like that ahead of time, I'm kind of responsible for. So definitely, usually I'm going in the room before the doctor. So, but yeah, at our clinic, it's just kind of, we both end up seeing the patient ultimately. So
yeah, it sounds like there has to be real trust in that relationship.
Absolutely.
In order for
there
that.
is. So before I did that, definitely I was going in and shadowing them, and I always have conversations and I speak with the doctor before they go into the room. This is the scoop, is there anything else you want me to ask, that sort of thing. But definitely kind of, I take the reins for a lot of those consults, which is nice.
Yeah, that's really empowering.
Yeah.
That role out there. So that kind of makes me think of when you would have very first started in PCN, and we know every nurse goes through a time of preceptorship and mentoring, and then they're on their own.
Yes.
Take us back to that first day, and what did that feel like for you, and maybe your worries, concerns, because I know there's a lot of people listening who will think, oh my gosh, what do I have to do? Will I be able to manage this?
Absolutely. Everything was baby steps. Like, I do a lot now, but everything started out with baby steps, talking with your doctors. What do they want? What are their expectations? What are your expectations? Everybody has to be comfortable. And I think communication is the hugest part of that, because everybody needs to be on the same page, because if you're not, then nothing's going to go well. So, but just have like faith and trust in the skills that you do have, and take it in little bite-sized steps. but it is terrifying. But just take a minute, step back, relax. You know everything. You just have to remember that you know everything.
Yeah. I mean, I guess 3 years is a long time to go back to and think of, what did I do to make myself feel a little bit less scared on that first?
Yeah, definitely, like, didn't overbook myself. And was just honest with the doctors, like, I'm not ready to do that yet. I'm going to come in and listen one more time so that I am confident that I can do this, and ask as many questions as you need to, because you'd rather the patient gets the right information than be cocky or too afraid to ask questions and then mistakes get made. So definitely, I'm still asking questions. Because patients will, that's how you learn as well. Like, patients will ask you a question. I'm not sure. I'm going to find out. So
Yeah.
just ask questions, take it slow. Don't put too much pressure on yourself, because that's not safe then either. So
No, and that's all really great advice. I think, as we come into a new profession, we are pretty hard on ourselves that we should know everything because I've just all
absolutely.
these years of schooling and I have this title and this responsibility. But to recognize that, in fact, none of us really know everything ever.
No, like, your basics, but other than those basics, that's just your ground level. You have to build up on everything from there, and that takes time.
Mm-hmm.
So
Yeah.
don't expect to be the same as someone who's been in it for 10 years, or be the same as the doctor. Like,
No. And listen, the
no.
doctors are still learning, and the ones who've been in it for years are
Exactly.
still learning every day. So,
Absolutely.
yeah.
So no, just don't expect like the whole world. Little bits at a time.
Yeah. Were you surprised that you liked PCN? I'm assuming this is maybe the first job you had after school.
Nope. So I'd worked as a casual float at the hospital for a little while,
Okay.
and then kind of just fell into this. I kind of knew ultimately that I would like it, because I'd been like the MOA and seen what the nurses did, and liked that. So not totally shocked that I liked
Say
it.
that again. You had been would you just say MOA?
MOA, yeah, medical office assistant.
Okay. All right. Thank you.
Yes, sorry. So knew that I kind of liked the environment. I thought that I would like acute care more than I did, but I think I missed sort of like building those relationships with patients and having more time with them. And I think maybe I had sort of a fictitious vision in my head of what I think it would be like. And then I got there and it wasn't quite what I thought it would be. And this kind of more suits my personality and sort of my vision of the type of nursing that I want to do. So,
Mhm. Oh, that's perfect.
yeah.
I know there's a lot of nurses who often talk about eights versus 12s, and you've already shared that you're working 8-hour days.
Yes.
When you were doing your acute casual job, were you doing eights or 12s then?
Mostly eights. Yeah.
Okay. So you have a preference for eights, or is there any, like I personally like that lifestyle, Monday to Friday.
I do. It's easier to, like, for me and my life, it's easier for relationships and friends and spouses and all that kind of stuff. But I think ultimately you make it work. Whatever you kind of end up doing, you just kind of figure it out, and that's sort of your new norm.
Yeah, yeah. Is there any training or courses or anything you can recommend for someone who might be considering PCN? I mean, again, I know it's very broad, as you've mentioned. It can be from babies to geriatrics to chronic management and blood pressure clinics and all those kind of things.
Absolutely.
Is there anything that they could do to set themselves up for success?
Definitely, I'd say the majority of primary care networks are looking for someone to have their immunization certificate.
Okay.
So I would definitely get that done. Make sure your CPR and all that stuff is up to date. But also, it's chronic disease management, sort of like online courses that you can do. Um, that's a huge asset, because somewhere along the line you're dealing with chronic diseases. So if you can just go online and do those, I think that would really set you ahead, and it's really great information.
Is that something only available to internal employees,
Nope,
though? No
not at all. No. And then I actually believe, I can't remember the name of it, but Norquest also had um, an additional course or diploma that you could do. And it was kind of all sort of like primary healthcare stuff. So, like ear infections, sore throats, headaches, like all those sort of things. Um, and my primary care network actually enrolled me in that, and I did that. But if it's possible to do on your own ahead of time, I think that'd be a really big asset as well.
How long
I can
was
try
that
and find
course?
the name of that for you.
Do you remember how long
Sorry?
the course was?
It was just online. So it was quite a few modules, but it was easy enough to get through.
Wonder if that's new. I didn't even know we had it there.
I didn't know either until all of a sudden I got this thing saying I'd been enrolled. So, but it was good. It was really good information. So, I'll try and find that for you.
Yeah, sure. We'll put that on a tip sheet maybe.
Perfect.
Awesome. Okay, so we've talked about the first day jitters and just trusting yourself, and some of the ways people can establish themselves and be prepared to better position themselves for a job in PCN. Um, so they get a job. They're in there now. They're working alone, or they're working with their team. Sorry, they've built the
Yeah.
trust. What kind of road bumps have you come across that others might need to consider?
Um, Workflow is kind of a huge thing at our clinic. We expanded really quickly with a whole bunch of new doctors, and sort of the expectation was kind of the same for the services that I was providing, even though the amount of doctors had almost doubled. So that ended up needing to be a conversation about what are priority appointments. Everybody needs to be on the same page about what's going to take priority over somebody else's type of appointment,
Mhm.
um, because you can just be pulled in five different directions at once, and that's really challenging when you're the only nurse. So just talking with your team, and again being on that same page, and making sure that you're not spreading yourself too thin and everybody has the same sort of expectations about what's being done in a day. So
So it sounds like that challenge is the same as acute care.
absolutely, yes, it is.
So
Anywhere you go.
there are some transferable skills.
Yes, yes. Yeah, no, communication and workflow and all that sort of thing doesn't matter where you go. It's going to be the same thing. So,
I love how everybody I talk to mentions the importance of communication.
yes.
Not because I'm biased towards it at all, but because I
No, not at all.
really know.
But yeah, definitely you need to be able to communicate with your team, or I don't know, it'd be chaos.
Mhm. Now, do you ever have to travel outside your clinic to see a patient in their home? Would that be part of a PCN role?
Um, Potentially, again, depending on sort of your doctor and what they kind of do. As a rule, usually it's just the doctors going and doing house calls, but I have gone once or twice.
I had no idea they did that.
Yes, very rarely. um,
Circumstances.
very. But I have gone and helped with like a pessary change and stuff like that a couple of times. But as a rule, you're in the clinic. So
Mhm. Oh, that's very interesting. Um,
yes,
mind blown. I thought like house calls were a thing of the 19th.
I know, I know. No, it's very, very rare, but
Yeah.
um, or sometimes maybe like a house call at a nursing home, that sort of thing. Um, but yeah, again, usually that's just the doctor going. So.
Hmm. Okay, so now this question may seem a little odd, but
Okay.
it's important to capture that just because nurses are in a profession that they love and they enjoy, that we can still have days where we're like, oh my God, what am I doing here? Have you
Yes.
ever had a day like that? And how did you transition and move forward from that?
Definitely when feeling overwhelmed with workflow, that's kind of when I was just like, no, like this is what we need to do. We need to figure out priorities, and definitely like being able to hash through it with somebody at the end of the day, debrief a little bit.
Hmm.
Um, and definitely like I have experienced in the past like some bullying and stuff like that at work, and that was really hard, but um again, just have somebody that you can kind of debrief and chat with about. And if you have sort of like a supportive company or group behind you that you can talk to and get some backup from, that I think is really important.
Hmm. Hmm. Well, that sounds like you did have some support, and you're still in the job that you originally been in for the last 3 years. So that's fantastic.
Yeah,
Because sometimes challenges can make a nurse leave or make a nurse want to change the area that they work in, and they kind of feel like they're losing a piece of their nursing. And I think it's important for those who are coming into the profession or those who have been working in the profession to know that not every day is going to be um, beautiful and wonderful, that we stumble and we struggle, and how do we pick each other up and move forward is important to know that that's a part of the trade.
exactly. Yeah, like it's not all sunshine and roses every day, and there's still bumps in the road, and patients are still people, and they're going to have good days and bad days, and
Hmm.
everybody on your team are going to have good days and bad days. So um, definitely you just have to kind of like roll with it like you would in life, and
Hmm.
try and get through the hiccups and yeah.
Yeah. Any memories in the past that just stand out as like, oh my God, that was an amazing day that you want to share, or maybe a connection with the patient, an outcome that you were able to influence?
Gosh, I don't know, like it's gonna sound corny, but like most every day I kind of have that where you just have, especially in this, like you kind of have those recurring patients that come in and you're like, hey, how are you doing? How was your week? Like what's going on? And give them their B12 injection or whatever it is. And just kind of like seeing those familiar faces and having a chat and maybe helping them out with something like that's always really nice. Or, patients who are really working on lifestyle changes and they come in and they're really excited to show you the progress that they've made and just knowing that you're a little bit of a part of that. It's really rewarding.
Yeah, that
Definitely.
is pretty amazing.
Yeah.
And that is why we stay in nursing.
Yes, exactly. Those happy days.
Those relationships, and you're so right. In the community setting as a primary care nurse, you do have that connection post discharge. I mean, that's where you pick up. I'm assuming you must have referrals to the clinic. Are there also walk-ins to the clinic that can just self-refer?
For certain things at our clinic, they could. Yes,
Yeah.
definitely. Mostly it's family patients, but definitely consults for a lot of the women's health stuff or sort of self referrals for those as
Mhm.
well. So, yeah,
Yeah, and so then you get to build that relationship where, in the acute setting, once we discharge them, we have no idea what happens to them. They come into your trusting hands, and that
exactly.
real nice connection there that can develop with your community provider.
Absolutely. Yeah.
Awesome. All right. I would normally have some questions for you from Facebook, but I kind of already asked a few of them as I'm scrolling down my list. One was travel to patients' homes. I already asked that. I kind of jumped.
Gotcha.
The other was what's been the most challenging part of getting your first job? Oh, that's a new one.
Um, I was really lucky and kind of got a job off of my first interview. They were kind of doing like a mass hiring at the hospital, it seemed, for casual LPNs. So luckily that was good, but primary care is a little bit hard to get into. The jobs are kind of so coveted that it's very rare for some to kind of come up.
Mhm.
So definitely somebody new kind of coming into it. Just be patient, constantly be checking um, all the different primary care network websites and looking for jobs. Even say that you're willing to do casual or less hours than maybe what you thought you were looking for, just to kind of get your foot in the door, because once you're internal, then the world kind of opens up for you. So
Yeah, that's right.
yeah.
Did you start full time? I know it was casual at the hospital, but when you got your PCM, was it full time or are you a part position?
I was full time.
Okay. I do see
um
the point positions come up like point 0.4, point 0.6. So
exactly, yeah. And so I know like quite a few nurses who are doing like say zero point 0.6 at one clinic, zero point 0.4 at another, and they just kind of like patch it together to full time or almost full time. So um definitely, but like once you're in, like you're in.
yeah, yeah, yeah.
Just getting in, that's hard,
Yeah.
but
And it's kind of, I'm actually glad you mentioned that some will work point 0.6 in one clinic and point 0.4 in another. Not undifferent or dissimilar to acute care, but it really
exactly.
opens up the possibility then to continue to branch out and learn different areas of nursing within that.
Exactly, or like you're covering a mat leave and it's maybe just a temporary, not ideal, but then you're in and who knows what's gonna come up after that. So just kind of be patient and keep at it and hopefully
Yeah.
something will come up. There's more and more PCNs popping up, so just, keep watching.
Yeah, I was just actually, I'd taken my son to an appointment for dermatology, and there was an LPN working in the clinic. And her
Yeah,
role at that point, she was, typing away as he was talking and filling out things for him. And I'm sure there's more to her scope other than just that, but that was my little exposure into her role at that time. It was another curious
absolutely.
student, so obviously it was awesome to see her.
Yes. That's so cool.
Yeah, it is pretty cool. They're everywhere.
They are, yeah.
All right, so nursing is a big part of our lives. People want to know, how do you stay grounded outside of nursing? I know I get consumed by nursing. I mean, I'm doing all these extra things and trying to keep the pulse of nursing out there, but what do you do for fun? This is a question from Facebook. What's your favorite thing to
Sure.
do
What
when
do I
you're
do for
not at
fun?
the
For me, it's a little bit extra hard to kind of step away from healthcare. My wife is a physician, so it's very easy for us to kind of constantly be talking about
clinic?
healthcare and work and clinics and all that kind of stuff. So we really have to make sort of like a conscious effort to like shut it down, stop, leave work at work. We just like doing outside things, making a point of planning dates, um, make a point of just making plans so that you kind of have to shut it off and go out and have fun. But just as much as you can, just leave work at work and, you
Well, you
know,
definitely showed not a dark side, a negative side to being in a relationship with someone of the same profession. You know, for me,
yes,
it's dreamy. Oh, it would be just so nice if I could have someone home to talk about these things, because my husband does not care.
no, yeah, friends only want to hear the like really interesting or the really funny stories. They don't care about anything else, or maybe just don't have an interest in it as much.
I would just,
But definitely it can be a bit of a black hole when you start just story swapping and kind of ruminate on things about your day.
yeah, you know, you don't get that emotional break. That resilience part of you is kind of left empty.
Exactly. And it can, and we've done that before, and we've been sort of in that rut, and we had to be really conscious about, just shutting it down, or we're only going to give this half an hour of airtime, and that's it. And okay, we're going to go for a walk now or whatever, and just kind of catch ourselves if we seem to be heading in that direction again.
Hmm. Oh, it's good that you've been able to find some structure and boundaries around that, but still allow that to foster your love of medicine and have those conversations.
Exactly, because I mean, it's still good to be able to talk about your day and vent and those sort of things, but
Mhm.
there's kind of that limit where it becomes too much.
Yeah. All right. So the other question I have here is for those of us who are struggling to find our fit in nursing, what advice can you give us to help us navigate it? The
talk
profession.
to as Talk to as many people as you can. Um, Find forums or friends of friends, anything like that. It sounds silly, but just like a pro con list, like what is something that I absolutely know that I don't want to do? I hate doing trachs.
Mhm.
Maybe put that off to the side. Um, but just sort of, or even if you're trying to decide, like, maybe I want to work at a nursing home, or I want to work acute care, or like community health, like, what's a priority for you? Does shift work matter to you? No, then that kind of opens up a few more doors for you. If you're really limited because you have children at home, something like that, like that's going to kind of lead you in a direction that you know you're going to need to maybe lean towards or look towards. But I think just talking to people and stuff like this, just hearing about the day and what it's like, and oh, that sounds like something I might like, or can I come shadow you? Just I don't know, just talking to people.
So that actually reminds me of a question I was going to ask earlier. I lost it, which happens in
Yeah.
every interview because we're having such a good conversation. My questions just go. Back to the shadowing. Can people just volunteer in a PCN clinic and come help out just to kind of get more of a sense? Have you ever seen that?
I haven't seen it, but I mean, we have students and stuff come through. So definitely if you're a student, that should maybe be a bit easier than just somebody off the street who's thinking about maybe doing nursing as a career. But if you're in nursing school or you are a nurse and you're interested in it, talk to the PCN. It might be an option, or at least have a meeting set up that, maybe, for patient confidentiality, you can't be in seeing exactly what's happening, but maybe they could hook you up with somebody and they can meet with you over a lunch hour or after work or something like that, just to get a sense of the flow of their day and
Mm.
that sort of thing. So,
Yeah, get a bigger umbrella, like 10,000 foot view, as opposed to getting right in there and seeing what's happening in the room, but you have a sense.
exactly.
Yeah.
Yeah, absolutely.
Awesome. Is there anything else I haven't asked? I'm sure we could talk for a long time.
Hours.
Anything that you think those listening should hear, should know, should consider about the PCN role?
I don't know. I'm just like biased. I just love it. I like I like being on that like preventative side of things and trying to make a difference and putting sort of like less like weight on the acute care system so that people who really need um that time and that money and those beds can go to those patients. If there's something that we can do before things get that bad and take a little bit of strain off the system, then
Mhm.
that's great. And that's just working as a whole healthcare team then. Um, I love chatting with my patients and seeing them, and sassy patients, and I don't know. um, I just love it.
So in terms of this, so I've got a few more questions now
Yeah.
because this is what I love about interviews. Keeping them home. essentially is the goal, right? We're working with them so they don't need to be readmitted to the hospital.
Exactly.
Your community partners then, are you closely linked with and working with home care services or other community agencies on a regular basis?
Absolutely. So, huge contact with actually like social work, um, psychologists, psychiatrists. A lot of the primary care networks have like diabetes clinics, blood pressure clinics, exercise specialists, nutritionists, dietitians. So, making those referrals all the time. We have prescriptions to get active, where we're offering like free passes to gyms and just encouraging all those sort of like healthy lifestyles. So constantly talking with different areas of like, how can we help our patients do this? How can we support them? Not that we're just saying, well, you need to do this much activity this many times a week, go and do it. We're offering that backup, we're offering that support. Call me if you need to. But definitely constantly in contact with other places, just to offer as much help and as support as we can
Mm-hmm.
for those
Mm-hmm.
patients, so they're not just being told something and then being sent out.
Right. There's some more continuity there with all the community partners, it sounds like.
Absolutely. And they're just sort of feeling bolstered by
Yeah.
a whole bunch of people, which is
Yeah, that's lovely. That's lovely. So it made me also think about today's political climate. I don't really like
yes.
to talk about politics so much, but it's almost as if we're kind of forced to talk about politics in
Yeah.
today's profession. How are the current changes in government with regards to funding and staffing? Has that impacted your guys' clinic at all?
I haven't seen it yet, but it is a little scary wondering, like, is there still going to be interest in primary care networks, or is it just going to be clinics sort of like privately hiring nurses to kind of do the same job? Because right now we're hired through the primary care network and then just sent out to the clinics. And those primary care networks have all those extra courses and classes and stuff like that. So who knows what's going to happen, if they're going to sort of keep the primary care networks around, or if it's just going to be kind of like a more private clinic kind of thing.
Are there some rumors or some concerns kind of starting to surface, or is it more just forecast?
I haven't heard anything yet, but just by doing some reading and stuff, you kind of aren't kind of sure which way
Yeah.
things are going, with cuts and stuff already going, you
Hmm.
know,
Hmm.
is that something else they're going to cut as well, or are they going to see that as money saving because we're preventing
Frustrating. Yeah.
strain
Yeah.
on acute care? Who knows?
Yeah. Well, that was all very fascinating. See, again, I could probably ask you 100 more questions, but we don't want to take up all your day.
No worries.
I want to thank you so much for joining us
Thank
today
you for
on
having me.
Frontline Nursing. It's been amazing talking with you and learning a little bit more about what a primary care nurse does and the vast variety of opportunities that exist within that trade.
Absolutely. Thank you so much.
Yeah, awesome. We will talk again soon.
Sounds good.
And if you'd like to be featured on our next episode of Frontline Nursing, send me an email at info@tammydunnett.com and use the subject line Frontline Nursing.